Fibroid actually mimics symptoms of pregnancy. I have seen so many cases where people or mothers come to the hospital thinking they were pregnant, but it's actually fibroid. She has all the symptoms of pregnancy: the extended abdomen, morning sicknesses, tiredness, nausea. She has everything that says, yeah, I'm pregnant, but it's actually fibroid. So yeah, fibroid does mimic some symptoms. And so the most important way to find out if you have fibroid is to do a pelvic scan. Treatment depends on the size of your fibroid, where it is located. It also depends on the symptoms of fibroid you're experiencing and if you're done with childbearing. Okay, do you still need children? That would determine if hysterectomy is going to be an option, which is surgical removal of the womb, right? Fibroid is also known as uterine myoma or leiomyoma. It is a non-cancerous growth that develops in a woman's uterus during a childbearing age. So if you actually went for an abdominal scan and you saw the word myoma or leiomyoma on the printed scan result, then it means they are referring to your uterine fibroid. So yeah, don't get scared when you see the word. Causes of fibroid isn't well understood, but it is believed to feed and grow on the woman's female hormones, hence why it shrinks immediately the woman hits menopause. Hope you know the hormone or estrogen and progesterone drastically reduces when the woman hits menopause. Risk factors, which are sometimes known as causes or maybe known as causes, refers to obesity, also includes early onset of puberty, or having a family history of fibroid, or not having children on time, or not even having children at all. Signs and symptoms of fibroid includes irregular menstruation, prolonged bleeding, heavy menstrual bleeding, or persistent abdominal pain. Other signs and symptoms include pain during sexual intercourse, urinary problems, and distended abdomen. Large abdomen or stomach that makes you feel like you're pregnant, but you know very well that you're not. Or sometimes it might even mimic the symptoms of pregnancy. You might feel all the symptoms of pregnancy and you think you're pregnant, whereas it's actually a fibroid in your stomach. Or sometimes you might not even have irregular symptoms. You might not even have the abnormal symptoms that are going to tell you, yeah, this is it. And you might not also know that you have fibroid. Okay, here is the good part. 1 to 2 women out of 3 of childbearing age are going to have fibroid or already have fibroid, right? So you are not actually abnormal. You are fine. You just have fibroid. The good part is it also does not affect your activity of daily living. It doesn't disturb you. Fibroid could just be there and you're giving birth. It doesn't disturb or stop you from giving birth. It also doesn't stop you from doing your activities of daily living. Fibroid can grow as a single nodules, or it can grow in a cluster carrying various sizes. So the sizes could range from about 1 millimeters to about 20 centimeters. That's about 8 inches, right? Or even larger. It could also be as small as a seed to as round as a watermelon. There are also different types of fibroid depending on where they are located. There is intramolar, there is submucosal, and there is subserosal. There's also another one called pedunculated fibroid. That's a lot of grammar, and so I'll spare you the details, but know very well that the different types and where they are located determines how your fibroid is going to affect you. So yeah, your type of fibroid and the effect it has on you and your fertility or whatever is happening to you as a result of your fibroid is dependent on the type of fibroid you have and where it is located. At this stage, I will be talking about the medical and surgical treatment of fibroid. I would also be talking about its complications and 1 or 2 advices if you have fibroid. And please, if you're watching this video and you're not yet subscribed, please please subscribe to my channel just so you get videos like this, because I have a lot of them I have done and I'm still willing to do more. All right, also look out to another video on natural method to shrink fibroid. I really want to put that video out there. I already recorded it, but yeah, I wanted to bring this one out first. I told you we have medical and surgical. Let me go through surgical before I go to medical. For surgical, we know that small fibroids do not need to be touched. You do not need to remove it. You could still go about your daily activities, because sometimes when the fibroids are small, they do not even disturb you. You're just doing your thing. You don't even know you have fibroid, right? Yes, you can also get pregnant if you have small fibroid, deliver your children without any issues, okay? Your fibroid will be there and your baby will still grow in your womb, okay? But then if the fibroid becomes disturbing, if you have all the symptoms I have mentioned before, heavy bleeding, irregular menstruation, persistent abdominal pain, distended abdomen, it means at this stage the fibroid is now very, very chronic, right? It's gone to the serious phase. So you need to do a myomectomy, which is surgical removal of fibroid. Then again, you could do an hysterectomy. That's if you're done with your children or you don't want to have children, you just remove your womb. Of course, if you remove your womb, they will take it out together with the entire fibroid there. So yeah, voila, you're fine. So yes, we have myomectomy. We also have hysterectomy. There's also a laparotomy, which is another procedure that could help you and your fibroid. For medical management, you should meet your doctor for appropriate management medically for your fibroid, especially if you're having excessive bleeding or irregular menstruation. You should meet your doctor, okay, because he's going to have to assess you and see which drug is appropriate. There's also another drug which I'm going to put up on the screen, which is very, very used for management of fibroid. The complications, we have pain. Okay, you might think it's a joke, but I've nursed the patient with so much pains due to fibroid, and I was wondering, like, I think it was the first realization that fibroid could also cause so much pain. Yeah, so pain is actually a complication, especially severe pain, definitely depending on the pain threshold, right? Then I have distended abdomen. You feel bloated, the abdomen is quite big, looking as if you're pregnant. Then another complication is excessive bleeding during menstruation. Okay, you're bleeding so excessively, and then due to so much loss of blood during menstruation and all, I have anemia, which is low blood. And then a long-term complication is infertility. Okay, infertility is also a complication of fibroid. Finally, you can be pregnant even with fibroid, okay? You can have children even with fibroid, but it does predispose you to certain health conditions like preterm labor, okay? Delivering before the baby is reached the time for delivery, or separation of the placenta, okay? That's another complication. Or it could also predispose you to having a cesarean section, which I don't see as a very bad thing, okay? You just have to see your healthcare provider, okay, for appropriate management. If you've watched up to this extent and you do believe I tried my best in dissecting this topic, please leave a comment on the comment section and give my video a thumbs up.